What breast implant is best for me? It's a very common question, and we're going to break it down full throttle next. Hey, doc audience. Well, this is a great topic. Patients often will call and say, I want a specific breast implant. Or Armando, they call and say, or out in talking to their surgeon, what breast implant is best for me? There's not one answer for that. It kind of depends. How do you approach that, Armando?
Yeah, there's almost never one answer for that. And actually, what I'm seeing most of now is they even take it a step further and they say, my friend had this implant and I want to look like her, so she looks great. And so that's the implant I want. Will Dr. Soto put that in me? I always tell patients when that comes up is, if you let me pick the surgeon, the implant, the right implant for the patient is going to happen automatically. So there's lots of different implants out there. There's lots of different implants that could achieve the result the patient might want. But the key is really finding the best surgeon for you.
Yeah, Peter, in terms of, do you feel like that there's one implant that serves everybody, or how does that work?
We are fortunate enough that manufacturers provide a whole menu of implants, almost any manufacturer. And when patients come to me with that, I can pull out an implant catalog and say, look, these are all our choices. We need to figure out what works for your anatomy, what works for your breast implant, what the platform the breast is sitting there, what works for your measurements, how we can achieve the best possible result. And when you speak with patients in this way and show them things, they start understanding, and you can influence them for getting some kind of sensationalistic approach that they learn from social media. And that's kind of my approach for it.
Ed, how do you handle that question?
I think the way to do it is just step back and start at the beginning. Why did you come asking for this particular device? What led you here? Where'd you get this information? But the best breast implant for a patient is just based on their measurements and their goals and what they're looking to achieve. And the only way to figure out the breast implant for the patient is in the consultation room, after measurements are taken and after you listen to those goals and have that discussion with the person that you're having consultation with, their husband, boyfriend, whoever. And just being able to go through the different nuances of an Allergan versus a Motiva versus a Mentor, and the cohesivities and how they stand up with upper pole fullness, and really explain that and let the patient synthesize that information that you give them face to face into their own personal choices and to best fit their goals.
Other advice I would have with patients in this situation, especially when they're a little bit confused, and some of them are, is to have them come back a second time. Give them the information just like we heard here, and then have them go home and digest it and come back for another consultation. Oftentimes by that time, their mindset has changed.
I think it's a very complex topic because there's not one right answer, but I think that patients sometimes think, there's just one implant that's the best, or if my friend got this implant, like you said, Armando, that's this size and this type, then that's what, if I get that, I'll get the same result. Her friend may have a 11 centimeter wide breast and a loose skin envelope, and she has a 12.5 centimeter wide breast. And so it's just that implant's not going to fit the breast. So again, that's why you need to go see somebody that has true expertise in the procedure. Starting again, board certified plastic surgeon is great, but it needs to go beyond that. Somebody that actually has expertise in breast surgery. And then it's all about educating patients. We spend a huge amount of time and energy in our practice trying to educate patients, because this is the most important thing. The more patients know, the better that they do. It's a great topic, but it's a complex one.
Yeah, I think, one of the key points to make is, just to emphasize what Ed was saying earlier, the consultation and the examination are critical. And I think part of the problem with this subject is that often patients don't want to have to go through the inconvenience of coming to your office and submitting to an exam and spending an hour of their time talking with you about what's best for them. They want you to be able to give them a quick answer over the phone through your receptionist, and you just can't do that. Good healthcare in general involves, an examination and a long talk. So I think that's really the short answer, is you got to come into a good surgeon's office and get the answer that way.
To piggyback on one thing quickly, the decision for the actual type of device does not have to be made at that first consultation. That can be done at a pre-op or a follow-up visit like we were talking about. I think that giving that information, doing some sizing, doing at-home sizers, computer imaging, whatever you're doing in your office, all we have to do is provide information. Just as long as we make the decision on device and location before surgery, it doesn't have to be made on that first day.
All right, that's some great stuff.